being a black woman in America is not the easiest. What are some of the unique challenges that you personally may have faced as an entrepreneur?
The reality is, in the early days, I used to say, let me go find a white man to tell you what I'm saying because you're not listening to me. I believe it allows another person to kind of stop in their tracks and say, whoa, okay, what can I do to be more considerate or be more inclusive?
So, what is inspiring every day to keep going?
Because I need this, because we need this, future generations need this.
My name is Tiffany Whitlow, and this is Now Included Unfiltered.
Hello, everyone. I'm Dr. Michael H. Forde, and it is a profound honor to be here today to moderate this discussion on women's health, innovation, and entrepreneurship during Women's History Month. And it's a very special time where we don't just look back at where we've been, but we look forward to where we are going. And today, we are joined by some very special architects of the health equity movement. And these women are not just anybody. They're participating in the industry. They're actively reshaping it every single day through their lived experience, through their clinical innovation, and through their community forward technology. So first, I would love to welcome Camille Campbell. Dr. Camille Campbell is the health equity and clinical innovation lead at a biopharma company, and she has nearly 2 decades of pharmaceutical industry leadership, including key roles at Biogen, AstraZeneca, and AbbVie. And she has spearheaded groundbreaking initiatives to bridge the gap between medical innovation and underserved communities. She brings a wealth of expertise in health equity, clinical trial diversity, and building the community trust necessary for true medical progress. And next, we have Tiffany Whitlow. Tiffany is the co-founder of Aconit, which, if you all are watching or listening to this podcast, you may be familiar with. In case you're not, Aconit is a health tech company focused on improving health outcomes through the intersection of data and community engagement. Through the Now Included community, Tiffany has built a platform that connects underrepresented populations to the health resources that they need and provides opportunities to learn more about clinical research, shaping a future where representation is not a goal, but a reality. So, ladies, I want to thank you so much for being here today. You all work hard, and you work hard to solve one of the most pressing challenges in our society, and that's making health equity a tangible reality rather than just a buzzword. And so we'd like to share a quick disclaimer that all thoughts and all opinions shared during this podcast are the panelists' own, and that they are here to represent themselves as leader within the industry, not any particular company. So thank you all again, and let's dive in. Let's dive in. So the first question that I want us to focus on is a discussion point for the entire group. We know that women often serve as CMOs, chief medical officers of their homes. So, how can the healthcare industry better support women in this role while ensuring that their own health needs are not neglected?
Dr. Pope, you or me?
Well, first of all, my last name is not Pope anymore.
Hold on. Dr. Campbell, you or me?
You can go first, Tiffany.
Okay, well, are we talking about the husband or the three kids? I mean, man. Well, first of all, you can just start bringing healthcare directly into my home as industry is already doing by offering at-home testing, blood testing, everything else, because getting my husband to go anywhere is just hard. Okay, that's just reality. I actually also have the privilege of serving as chief medical officer for my family. And so this is encompassing my grandparents and my parents. I'm actually really proud of where industry is already shifting. Things are becoming much more predictive, much more personalized. And so we have to continue that education early and often so that people understand that it might not be for you today, but don't wait until you have to have it to consider it health care, because we can help change health care by going there before you actually need help. It's not help care. It shouldn't be help care. And so just the reality of making sure that you're going in for the preventative care, that we are educating ourselves, that we aren't letting industry bypass us. So you can't be afraid of being a part of the future solutions. We have to be much more a part of those solutions. And so for me, it's just a matter of making simple things, making sure you get your 6-month cleaning at the dentist, Making sure you're going in for the annual checkups, just as easy as it is for my kids when they're under the age of 18, because the doctor says you have to come here for your yearly checkup. That's really what we all need to do. So if I could get my husband just to do those small steps and understand that we do have a 3-year-old and I need him around for a really long time, he needs to take care of himself.
That was a good answer. I, I agree with Mrs. Whitlow, with Tiffany. Helping to make like all of the things that we need to do as women to take care of ourselves when it comes to preventative care, testing, and things like that as easy as possible. Even when it comes to flexibility of scheduling, because we all lead busy lives, and a lot of times, if you are the chief medical officer of your household, then not only are you managing your own schedule, but you're managing the schedule of a spouse or kids, or maybe you're a caregiver to parents. And so being able to take care of yourself when it comes to your healthcare needs to be like as simple, and you need to be able to fit that into the schedule of everything else that you have going on from work and caregiving. The other thing is listen to us once we get into the doctor's office. A lot of times, as women, and I've experienced this personally, I'm sure Tiffany has as well. We get into whatever the appointment or whatever we're in the doctor's or physician's office for, and we're sharing what we're feeling, we're sharing symptoms, we're sharing things that maybe seem a little off and not right, and we're not really being listened to fully. And so for us to then have to go home, do additional research, take additional time to figure out, well, what's really maybe going on with me, because I didn't feel heard by the healthcare provider that I was trying to share my situation with, like that takes time too. So now you have added another task to my to-do list to help me figure out what might be going on with me, because as a healthcare provider, you really didn't take me seriously or didn't listen to what I was saying. And now maybe I have to again figure it out on my own, or find another trusted source, or find another physician. Like that's a lot, right? So in addition to making it as easy as possible for us to get the care that we need, when we do come in to get the care that we need, really listen to us and help us find solutions to whatever situation we're coming in for.
Triggering. Whew, it's an uphill battle.
I don't know. Once you get the right care team, it's not as uphill of a battle, but sometimes that takes time, right? Like,
My Gemini or ChatGPT a part of my care team?
are you checking the references for, how I feel about that?
Still, for some people who can't afford to go into the offices, I mean, they are really using Google, Gemini, ChatGPT. I mean, people are still relying on the internet, which is, I think, why platforms like Now Included are kind of taking off, because people want to see that user generated content. They want to hear from each other. I want to see what Ariel's doing on her page. I want to see what's really impacting her and what's moving the needle.
You're right. Some people don't even have a primary care physician. It might be hard for them to connect with healthcare providers. So you're absolutely correct. Chat GPT and Gemini can serve as good starting points, great aids, but just know that like sometimes the information there isn't always accurate. So, you have to be mindful with checking that against, information from actual experts in the field.
Mm-hmm. And now I just want to jump in here because Tiffany, you mentioned something. You talked about AI, right? And we're talking about Gemini, ChatGPT, and we know that we're in a day and age where technology literally is marrying with 2026 in terms of healthcare outcomes. And we know that you're the co-founder of Acronym. So I want to ask you, because you've built this platform, first of all, that uses a lot of data and uses a lot of technology to assist patients to foster that level and sense of trust. And being a woman in America, as we know, is a black woman. Let's just talk about that. Being a black woman in America is not the easiest of things. And so, what are some of the unique challenges that you personally may have faced or experienced as you've been rising up the ranks and you've been developing and growing every day as an entrepreneur in the health tech space, especially when your product is something that the community really has to embrace and trust?
Number one, To know me is to know that the name of the podcast is Unfiltered, because in real life, it is unfiltered all the time. It's actually very hard for me to be filtered. So I don't allow there to be an elephant in the room. The
Mm.
reality is, in the early days, I used to say, let me go find a white man to tell you what I'm saying because you're not listening to me. And by saying that, at some point, I believe it allows another person to kind of stop in their tracks and say, whoa, okay, what can I do to be more considerate or be more inclusive? Or even for me, what is my tone? How's my delivery? How's my energy? Like, what could I do to be more definitive? Like, women provide a lot of context because we speak with a lot of emotion, and because there is a lot of context. There's a lot of reasoning and a lot of layers, as one of my friends likes to say, to us and our ability to make decisions. So, as an entrepreneur, I carry that over into business. I understand that I have a team of 71% Black females. I have 71% females, and the majority of those are still African American females. That's a lot. So, the personal desire to want to, number one, encourage them to be in my seat if that's something that they want. Number two, to remember that no matter what role you play here at this company, in this juncture in your life, it's important and it's required and it is needed. And I think just being honest and open about the struggles that I see even at this level. So that people don't feel like, oh, well, I'm just doing this one thing off to the side. But, when I get to this next point as a manager, I'm not going to have these challenges. No, boo, you're going to have those challenges and more. And you're going to have the challenges of all of your team to get to carry it on. And that even means, Michael, that caring for yourself changes and morphs over time.
Mm.
So I'm not only trying to help people understand, okay, how can you leverage technology to best do your job? How can you leverage technology so that you can carve out time in your schedule for self-care? How can you block off time early in your day or at the end of the day to focus on your mental health? For me, recently, it has been going to the gym. Friday mornings, I come in 30 minutes late because I'm running over from going to the gym. And many days, I'm going to a 4:30 p.m. workout class, which means I'm probably skipping lunch in the middle of the day to make up for that time crunch. So I try really hard to lead by example. And I tell my team, like, I'm trying to lead by example. This isn't just the way I'm doing it and you should do your own. I'm trying to lead by example. Like, no, carve out time in your calendar, make time for yourself, prioritize your time. We do that even by giving out PTO hours and making sure that people have healthcare coverage. From a very early stage, we were offering healthcare coverage, even when it was very expensive for us to offer for our employees. It was very important for us. We can't tell people to want to empower themselves and their communities to take actions for better health if we're not helping them to do that.
I want to go deeper. I love everything you said, but I want to ask you, what inspires you to go deeper every single day, right? Because you're literally building a product that is going to be a blessing. It's already a blessing. It's going to continue to be a blessing for community members, for people who are seeking the innovation that you are building. So, what is inspiring every day to keep going?
Because I need this, because we
Mm.
need this, because future generations need this, because this didn't exist before us. When we started Acclinate, DEI was not what DEI was pre our current administration, and it isn't better representation as it looks today. And so the reality is, we all together are building something that it has an opportunity to be here beyond us, but we all have to be in this and we all have to be a part of it in order for it to be successful. And so for me, I had no idea that albuterol was developed through this thing called a clinical study. And I did not know how to be a part of it, even if I ever wanted to be a part of it. So, at the fundamental basis, drugs will not be created and be as effective for the majority of our population if we are not positioning ourselves as a part of the solution, period.
Mm. Mm. Man, what is that? The clock it? Is that what they do? People do now, the clock it? My
I'm not
wife
that
my
young.
wife taught it to me the other day, and now I can't stop doing it. Um, now I love that you said at the end of the day you're doing this for you, but also because of the people that need it, for the people who did not know that. For instance, you brought up the albuterol example. There are so many individuals, and there's so many other drugs, and there's so many other cases that we did not even mention today. So it actually leads me now to Dr. Camille. That's a perfect segue, right? We know that you have plenty of experience in the biopharm industry, and you know, talking about pharmacy, we also know that um, if we live in a day and age where it's critical for healthcare companies and pharmaceutical companies to move away from quote unquote performative diversity in clinical trials, right? So, for you, especially with your experience, how important do you think that is? And then also as it relates to what we consider real equity.
Representation in clinical trials is very important. And when we think about representation, it's important to think about it in a lot of different ways, right? Obviously, there's race, there's ethnicity, which are social constructs, by the way, but they're often proxies for other factors like non medical factors or social factors that impact people's ability to participate in the healthcare process, including clinical research. And like Tiffany said, if you don't have everyone having the opportunity to participate in clinical research, then when medicines actually become available to the general public, you don't know if they necessarily work in everyone. When we think about performative, it's kind of like, to me, it's when we only are focusing on like a number in clinical trial diversity. But then what happens after you reach your clinical trial diversity targets, after you do enroll like the 20% of Black patients that you were looking for? Are you taking the extra step as a healthcare organization or a pharmaceutical company to ensure that everybody, including those Black patients who now enrolled in a clinical trial, are actually going to have access to the medicine when it becomes approved and available in the public? Clinical trial diversity efforts and representation in themselves are not performative, but like if that's all you're doing, you're not thinking about like the entire healthcare ecosystem for everyone and making it more equitable, then it becomes performative, because it's like you only care about your numbers and you don't really care about making the drugs accessible to everyone. That takes a level of like embedding health equity principles into all of the different areas of, say, a pharma company. But in order for that to happen, like, people have to internally believe that it makes sense to do that and that it makes business sense to do that. At the end of the day, if you're putting patients first and your goal is to get medicines to every single patient who might possibly be eligible to take that drug, then those are prescriptions that are written and those are dollars that are made. You got to invest though. Like, you can't just be like, oh, yes, this is important to my company, but then like you have a health equity team or a clinical trial diversity team or whatever, and they ain't got no budget.
Hmm.
What are they? What initiatives are you supposed to be able to successfully execute if you have no money, right? That is truly performative, right?
So, what you said really resonates because when you think about equity, this concept of equity, it's bigger than just, hey, you get the same thing that someone else is getting. I always like, I'm wearing a suit today. I love suits. Tiffany, we're suit buddies. I love it. I'm sorry, Dr. Cam. We're just going to have to tell you ahead of time next time. But listen, I came up with this thought the other day, right? Health equity is like a suit, and I'll explain. I have a lot of suits in my closet, and I love to go to like Joseph A. Banks or Men's Warehouse, K&G. I love a good tailored suit, right? I love a good suit. But just because I go in a suit rack and I say, okay, this suit fits me.
Mm-hmm.
Okay, it fits me. Okay, but was it tailored for me? That's health equity.
Mm-hmm.
You can wear a good looking suit all day. It can fit you all day. But just because it fits you doesn't mean it was tailored for you. Doesn't mean it was bespoke.
Yes.
It doesn't mean it was custom created. So when you think about what we're talking about today, it all goes into, we have to create technology, innovation. We have to create methodologies and skills that allow our people to feel like they're being catered to because we're tailoring the product for them. Which brings me to my next question. Online, I have a lot of things, but one that I love, and a lot of the social media videos that I do, it's healing starts with knowing. We're in a space, we all are in space where we're trying to bring people to healing, right? So
Mm-hmm.
where does that connection between healing and knowledge lie? Like, what does that mean for you in your respective areas of work?
That's a difficult question.
Yeah.
I don't even know why. Um, because it's our whole being.
There you
Like,
go. Go on now.
so I guess, well, number one, more times than not, you might feel stuck or stagnant. And
Mhm.
so it's the reality of just reminding someone that we're in a better place today than we were yesterday.
Mhm.
And I love the slow and steady approach versus the hurry up and get there fast, even though I drive really fast. So don't ask me about my driving. But in life and in business, it's definitely slow and steady. So
Mhm.
community is should be personalized,
Mhm.
and just like healthcare. And what one person's story and reason for not even opening their ears to clinical research was because of Tuskegee and syphilis study, right?
Mhm. Mhm.
Another person's reason is, I literally have never been afforded an opportunity, but now that you've talked to me about this, I'm interested and I would be willing to pre-screen or to fill out a survey to see if I might qualify in the future. So I guess for me, it's really just that individualized. Like,
Yeah.
I can go into a group in rural Alabama and I promise you I'm hearing about Tuskegee and the syphilis study, but I can go into a group in inner city Philadelphia who's not mentioning that at all and literally just wants the examples of how they're helping to better and move forward through these smaller actions. And it's funny enough, oftentimes that is at some inner city YMCA or some place where someone's already active and taking those like physical real time steps. So in their mind, it helps them process and know, like, okay, well, I started by showing up at the gym. Next, I'm going to start eating better. And it's like, okay, now that you're doing this, how can you help someone else do that? But for me, it's less of a broad, it's not never really a broad generic answer. It's very personalized.
I love that aspect of it being individualized, right? Because it's something that should be interpretive for how you do your thing.
Yeah,
I just wanted to take a stab at it, Dr. Cam, as well.
some things clicked in my mind around healing starts with knowing, and like I make it my goal, whether it be in my professional life or my personal life, like to help people be as informed as they possibly can so that they can make the best healthcare decisions for themselves, especially given my background, right? I'm like, okay, God did not give me this, the education as a pharmacist and this ability to have worked in these different spaces within pharmaceutical industry, but then I've also worked in community engagement and health equity and like done the work of being out in the streets with the people and like feel it is my duty to go to those people, whatever that looks like, whether it's a family member, whether it's at a health fair, whether it's at church or whatever, and with love and care, like to use my skills to help guide them to make the best decisions for their health. So to me, that's what did you say? Healing is knowing. Is that what it
Healing
is?
starts with knowing.
Healing starts with knowing. Healing starts with, me being able to like kind of connect you to the right kinds of information, the right kinds of resources, using the skill set that I've been blessed with. And, you'll heal because when you know better, you do better. Who said
Ah, come on, man. Wow, I'm the
that?
moderator, but I'm the one leaving with the word that you gave me. My goodness, thank you. Wow, I love that. Tiffany, I want to ask you. So we know that the now included community. First of all, congratulations on how great and amazing it is. Such a major innovation, especially in how we every day are connecting underrepresented populations, especially to be culturally competent, which is such a big thing, being culturally competent and community forward with health education and research. So the question is, how can we use technology to be used to bridge the gap between medical innovation and underserved communities without losing the quote unquote human touch?
Come in real close.
Okay, I'm
You.
here. Okay,
You
okay.
you are the answer. Exactly what you do on your platform,
Mhm.
the way that you instill trust on your platform, it's you. It's
Yeah.
you, it's me, it's Dr. Camille. It is every one of us being honest, vulnerable, open. You leverage technology to allow people to have I know opties out there too, channel
Mhm.
approaches, whether it be social media, a website, an email campaign, a mobile app. You want to just have something for everyone. Also with AIO, which was once SEO, search engine optimization, which is this AI optimization on websites, it's actually looking for user generated content and that thought leadership in a different perspective, right? So it's really looking for what are real people saying, what are real people doing. That's why TikTok has taken off. That's why people are buying on TikTok. People are buying in ChatGPT and Gemini. I mean, that's going to be our new way of searching and finding solutions. If you're not going to figure out how to be a part of it and how to leverage technology to scale, you're going to be left behind. You cannot just be boots on the ground and physical anymore. You have to have both. You just have to kind of always innovate and morph and shift again into what works for community, because you all who are watching and listening right now are driving the business decisions for not only companies like us, but companies like where you all work every single day as well.
You said something really important that stuck out at the beginning. You, to me, we are the answer to making sure that the human touch is never lost. But I also like the fact that, we have to adapt to the times, adapt to what's now, and then making sure that AI and all these tools, let's not forget who we are and who we're trying to help and what our purpose is, because sometimes we can get lost easily in the tools and technology that we forget the purpose. But I think just knowing that all a tool is a different way to get to the goal, but it doesn't change who we are as people. So this brings me to my next question. For either you can hop in and answer, but it's Women's History Month and we're talking about who we are as people. And so if we were to make history this month, um, what would be one untold story or one historical truth about women in medicine, about women in healthcare, et cetera, that you believe should drive our innovation for the next decade and the next decade and the next decade to come?
I am beating a dead horse by saying this, but I believe we are already doing that every single day. For me, it's now included our community by continuing to lean in, by continuing to sow into our inner circle. These are ambassadors and real people, and I have 69 of these people throughout 23 metros across the United States. By sowing into them, I am making history. That history might only exist for my kids. That history may only exist for the people who've worked here and helped us build this thing, but that is history. And so don't think you have to boil the ocean or be the next Martin Luther King to make history, because you don't. I was recently recognized as one of the 2 entrepreneurs in Alabama to be featured in Inc. magazine and make the list and be one of the founders. And I just say, like, even those small milestones are big milestones, because some teenage female is sitting in her high school classroom and looking at that and going to be able to see herself and say, what is this? What is this company doing? And how can I be a part of something like that? So I just want to normalize the idea that you can make history today, right where you are, with no formal investors, with no full-fledged idea, by moving forward.
Everyone has an untold story, even if you don't always tell it, because I'm actually pretty private. I don't share a whole lot, but those are the things that drive us, right? And they shape who we are, they shape our livelihood, and they shape our legacy. And it can look different for everybody, and it's driven by what's inside of you, what your passion is, what burdens you and makes you do what you do, whether it be for your job or for your work. So whether it's going out and, I don't know, serving food to people who are less fortunate, whether it's going and reading books to children, whether it's going to community health fairs and sharing information because you have, knowledge of a certain disease area because you've either lived it or you've worked in it, right? Like those things, and whether it's mentoring those in your industry who are coming up behind you, which is something that I'm really passionate about. Like those things are your legacies. And a lot of times you're doing those things whether you realize it or not, because you've got this untold story in you. And, maybe you decide to share it one day and maybe you don't, but we all have that. And especially as multifaceted women, um, there's always something.
If you could define or specify what that legacy would be, what would that be? Or what would you want that to look like?
For me, it would be Now Included. It would be the idea that we didn't have a place where we could all come and connect. I had a lot of desperate places online where I could go try to find information and resources, and we created that community for you and with you. Merging into my personal life, it would probably be my children. It would be showing not just the fact that they're my kids, it would be showing them that you can build something without a traditional education and in your community and with people you already knew. Our earliest investors were already people who we already knew in our personal life. It goes back into just being a good person, a good, wholesome community ambassador overall. I've always been engaged in community. I've always physically been involved in community. And so that is my legacy.
I would say within my industry or my career, my legacy, I would want my legacy to be for people to say, like, I opened doors for them, or I made a path easier where there maybe the path was difficult or there was no path. So like I have started fellowship programs. I have, started scholarship programs. Like I love to talk to people about like my career journey, because my career journey actually, wasn't a straight line. Like I took a little detour. I left traditional industry for a while. I did health equity. I did community engagement. I came back, and now, I went from being a medical director, like a traditional medical director, to now working as like a health equity director, right? Back in the industry that I had left for a few years, right? So also helping people realize that like you can follow a path that doesn't look like what you thought it was going to look like, and that's okay.
This is the part where I just standing ovation. Wonderful. I want to thank you all today, Dr. Camille Campbell and Tiffany Whitlow, for joining me and allowing me to moderate this amazing Women's History Roundtable discussion. It was a pleasure. I had fun. I enjoyed myself, and I learned a lot from you. So continue shining and being the leaders you are, because there's someone out there who will benefit from this conversation and learn that they can be whoever they want to be.
Hey!
Thank you for listening to Now Included Unfiltered. If you enjoyed this episode, be sure to give us a follow and leave a 5-star review. We'll see you next week. Next week on Now Included Unfiltered.
I would wake up and have blood in my mouth. My pillow's covered with blood, and I was like, okay, something's going on. And they said, your wisdom teeth are coming in. I had it pulled on a Tuesday, and I went back to the doctor on that Friday because my jaw wasn't going down. I went into the hospital. They said they were happy that I came in because there's a tumor that was in my jaw. My whole face was swollen, and I literally thought I was checking out. I really did.